One, and we're rolling. What's up, people? Dr. Michael Moeller here, and today I'm joined by Dr. Sam Madeira. What's going on, Dr. Sam?
Not much. Enjoying the sun up here in Seattle.
Yeah, and you just had a little bit of a hiatus yourself and figuring out the jet lag, or you're done with it?
Yeah, done with the jet lag back from Australia. So had a great trip and happy to be home.
Great. So a lot of people who followed the podcast know quite a bit about testosterone replacement, and Dr. Sam's one of the go-to guys. I'm actually curious what you did for your jet lag, though, if you wouldn't mind sharing.
Yeah, actually, there's some research to use Vitex, chase tree berry, for jet lag. And you take it essentially every 2 hours. And so I use Mediherb. I'm a big Mediherb proponent. I was actually in Australia at a conference for them. And take it every 2 hours, about 500 milligrams to a gram. And that seems to do it, along with high dosing melatonin up to 10 milligrams before bed.
Ooh, all right. That'll knock your socks off, huh? I took some last night. Gives me some really good some good dreams. So, you're a naturopathic doctor, correct?
Correct. Yeah, I went to Bastyr up here in Seattle.
Cool. Can you kind of fill me in on how you got there?
Yeah, actually, I started seeing now deceased, pretty well-known naturopathic doctor in New Hampshire, where I grew up, Dr. James Diadamo, who started the blood type diets. And Peter Diadamo's son has continued on with it. And so I started seeing him in the late 90s, about 20 years ago now, in Portsmouth, New Hampshire. And that really kind of changed my mind about becoming a medical doctor. I also did a lot of training in emergency medicine. I was an EMT and a wilderness first responder and on the ski patrol in my home state of Vermont. And I just found that after shadowing naturopaths and medical doctors that I'm really not a fan of hospitals and hospital politics. And I have a lot of respect, especially for surgeons and ER doctors, and some of them are my friends, but it just wasn't my path. So I chose naturopathic medicine, and actually my undergrad degree is in herbal sciences, herbal pharmacy through Bastyr University. So I use a lot of herbal medicine and love the herbal medicine and the science around that. So that's kind of how things fell in line for me.
Awesome. And I'd love to talk about specifically in the area of just optimization. That's kind of how I found a lot of the herbs, just being in performance, and then obviously how they interact with testosterone. Can you give us just some of your favorite herbs?
Yeah, for men, hormones, for thyroid, testosterone, and adrenals, I like withania, or also known as ashwagandha. That's a great one. Mediherb has a really concentrated extract. It's 1-to-1 ratio. So you only really need to do like a teaspoon twice a day or once a day, and you're pretty good in the morning. Rhodiola is great for focus and energy. Also great for dopamine and people that just need to keep their focus at work or in their daily life more. The other ones that I really like are Schizandra. So it's a Chinese herb. And Schizandra chinensis is the Latin name. It's great as a lot of different flavors. It's called the 5-flavor fruit, and that's great for the liver. Most people need some liver support, so it's nice to have kind of like a tastier liver support than some the kind of nasty herbs out there. That's also good for adrenal glands and sexual health, and just kind of overall health. It's liver protective and great for the immune system. Echinacea, actually, one of the great things about echinacea is it's great for the endocannabinoid system, which we're all kind of hyped up about right now for the last 2 years or more, because now we can use hemp legally in all CBD-based hemp in all 50 states. And there's up here in Seattle and down in California and Oregon and other states like Colorado, there's legalized recreational marijuana. So, you know, we're getting more into the science of our internal endocannabinoid receptors and CB1 and CB2. So instead of, if you don't react well to hemp, I have some people that I know and patients that just don't do well with it. you can use echinacea low dose on a daily level or daily basis and mix that with your other kind of adrenal tonic, testosterone tonic herbs. So the other one would be Korean ginseng. So Korean ginseng is great at protecting the body against all these EMFs that we're exposed to. I got my cell phone here and the laptop. And so I recommend that guys use Korean ginseng, and they could use that with like rhodiola daily. And I just find that I don't need as much caffeine. I'm a 1 cup of coffee kind of guy. And then I'm good. And then once I take my rhodiola and my cup of coffee and doing intermittent fasting, I'm pretty good to go for the rest of the day, unless I had a really bad night of sleep or jet lagged or something. Besides that, I mean, it's mostly about avoiding things. I think there's a lot of stuff and misinformation. I remember in the late 90s, Dr. Diadamo was still like promoting things like soy products for men. And, you know, obviously you want to decrease soy, and things like flax seeds, increasing sex hormone binding globulin. So there are a lot of like detox protein shakes out there now, and some of those can have flaxseed in them, well-intentioned. But for men, that can really bind up a lot of your hormones. If you have low sex hormone binding globulin, that could be good. But if you're really driving up your sex hormone binding globulin, you might not have a libido. It might kind of feel like a monk.
Yeah.
So,
well, and I feel, you know, it's almost like it's crazy how all these things really go together. And I'm really interested in how you go about the route with your patient. Coming from a world now that testosterone optimization is becoming so popular, I've worked at a clinic where that's basically all we focused on. And I'm working kind of in between the ND, MD world, because guys are coming in and asking for it. But like you're saying, man, if your adrenals are shot, if the thyroid's off, we have these other herbs that can kind of help bring balance. So when guys come in with these kind of low testosterone pictures, and you can kind of give me some clinical pearls as far as when the guys come in, what direction do you take them? Because in my experience, I think it is possible to help overcome a lot of these symptoms as far as fatigue, low libido and stuff. But it all goes together, and sometimes testosterone optimization with pharmaceuticals is the way. So kind of what's your approach with that when guys walk in and they seem kind of run down?
Yeah, I like to assess what's going on in their daily life. I mean, if you have a guy and he's running a company, a startup, and I'm in Seattle, and it's not, I mean, it's kind of like Silicon Valley up here. We have all the same tech companies and in some ways more. And the vibe here is workaholicism, I would say, like any other city in the world. In some ways, I find Seattle in the corporate world, kind of, I'm from the East Coast, kind of like the East Coast, where people are chasing the holy dollar and sacrificing their life for it.
Amen.
They don't know it because it's every day. So I like to assess like, hey, you know, are you working 40 hours a week? Are you working 70 to 100 hours a week? Like, what's your responsibilities at home and work? And is it possible for them to dial certain things back and even exercise 3 times a week or twice a week? You know, if that's not possible, if, you know, maybe they can change their diet and lose a little bit of weight. I like to work on all that lifestyle stuff, but I guess what I'm getting at is if the severity of their lifestyle and their illness is so bad that we can't change those things, you know, I kind of like make 2 categories in my mind, the changeables and the unchangeables. So you have the changeable variables, which is like, yeah, everybody can go to bed a little bit earlier, but how earlier, you know, can this guy go to bed if he's running 2 corporations or 2 startups? Or I think a good example is like an extreme example of kind of lifestyle change would be something like sleep apnea. So undiagnosed sleep apnea, if you can get somebody on a CPAP, get them sleeping at least 8 hours a night before 11 p.m. and working on their sleep and exercise, and then get them avoiding things like sugar and dropping, you know, if they're drinking a lot of alcohol, dropping that down and having, you know, 2 to 3 consecutive days with no alcohol. That can make drastic changes in their life. And then if you throw herbs in there, you know, I have seen people bring up their testosterone levels, you know, 60 to 300 points on the total testosterone scale. So come up from 300 to 600. If they have symptoms, like I like to use the ADAM questionnaire, it's the adult male aging questionnaire. And it's not very specific for testosterone. It's right around 30%, but it's, you know, about 90, 97, 98% indicative of there's something going on with their hormones. So I use that questionnaire, and then you get their labs. And if their testosterone's below, you know, 550, 500, and they're older than age, you know, 38, 40, that's kind of my cutoff. Then I'll kind of ask them like, hey, like, how open are you to doing testosterone therapy while we work on your lifestyle? Similar to using thyroid hormones while you work on somebody's lifestyle and workout. You know, is this something that is going to be long-term, or can they switch things around far enough where you can titrate them off in a year or 9 months or something? Usually I tell people to get the full benefit of testosterone optimization therapy, you need, 12 months if you're doing truly low dose therapy. And, I don't blast patients with testosterone. I'm not like sitting here with a testosterone gun, just like loading guys up. Yeah.
Yeah.
So I think that answers your question, but
yeah, I mean, I guess on my end, coming out of school, and you have a few years on me that, we're very naturally leaning. And as I started working with patients, and there are some guys, like you said, who are CEOs, they're working 60 hours a week, sitting in traffic, they have 3 to 4 kids, and they come in and they're like, I have to decide whether or not I can play with my daughter at night or if I can work on my paper because I don't have enough energy. And for me, it was tough to finally be like, okay, let's go this testosterone route because, it's a pharmaceutical. And like you're saying, can we use these herbs and these drugs versus drugs to get there? And like you said, it's my experience has been very similar. But there are just, there's a handful of people in the field that are like, hey, make them earn the testosterone, make them do all the things right first. And in my experience, and this is why I was asking you, it just seems like if you get them on the testosterone, they can make more lifestyle changes. Is that something you've seen or?
Yeah, actually, I got into this kind of by accident or out of necessity, I guess. I got out of school and I had been working a job, and then I did that for a year, and then I was applying to jobs, and one of my friends from Bastyr said, hey, I'm working at this low T clinic, this men's health clinic, and I think you would like it, and I want to hire you. I want you to come on board. So I got the job, and I worked there for a year, and I ran 2 out of 4 of their clinics for a year, working pretty long hours. And I saw like 15 to 30 patients a day, really busy. And it was an awesome experience. And we did testosterone, we did some vitamins and nutritional counseling and, consulting on that. And then we did some like Myers cocktail IVs, this 2013, 2014. And then some B12 shots. But I mean, the gist of it was, paleo diet, and talk to them about like, hey, maybe you need some adrenal support, vitamin D and B complex, and then get them on the testosterone, and then maybe talk to them about like some B12 shots. And it's a pretty simple business model. And I think a lot of our naturopathic colleagues would really kind of hammer on me about, hey, I don't think this is naturopathic and stuff. And I would just say, you know what? I know that you read some research article that's very theoretical to you and you're very evidence-based, which I think I am too, but squats and deadlifts aren't going to happen for this dude. Working 100 hours at a tech company, running a whole team, and he has 2 kids at home, like you said. And it's not like, oh, can I have sex with my wife whenever I want to? It's, I don't have energy to play with my kids or my grandkids. And if it's that bad, then really it's about, why make somebody suffer for 6 months or a year and make them quote unquote earn something when you can get their levels up. And, right before we started this interview today, I was just kind of like briefly going over a video that one of the guys in the testosterone optimization world, Nelson Virgil, has Excel Male, and he has a video about how low is too low, and it's all about the evidence and like the world organizations and what they agree on what's too low. And there's research that says if your testosterone's at 400 nanograms per deciliter total testosterone, then you're already having vascular issues develop in the penis. You're already having, potentially, if you're older and it's been going on for a long time, you could have like dementia setting in your brain and cardiovascular disease developing in your heart and the rest of your body, varicose veins. And my thinking is, why let somebody suffer? And naturopaths up here prescribe thyroid medications like it's candy, and there's a lot of side effects from things, especially the trademarked thyroid medications like levothyroxine can cause SIBO. So my thinking is, we're using in my case and in your case, we're using compounded medications, the lowest dose necessary, I do lab testing every 3 months, or, sometimes if I need to check in, I'll just check in on a couple of things sooner. But in the first year, and I actually did a trial with a patient because they were like right around age 40, and I was like, let's do some high dose herbs. Let's do like Korean ginseng and Eleutherococcus tincture, and work on your lifestyle and your diet. And they work at a tech company. They run a team, and every 6 to 8 weeks they travel from Seattle to Chicago to London and then to Asia. So they'll come back, and then 2 months later they'll go to Asia, and then 2 months later they'll go to Chicago, and then 2 months later they'll go to London, and they're kind of like doing this cycle every year. And I checked their testosterone 3 months later after doing a very aggressive herbal tincture treatment plan, and this person's sleep has always been a problem, and they smoke, and they weren't really compliant on diet. And we're talking about male patients here. We're not talking about like some girl on Instagram who's like a yoga instructor, right? So they're not in the world of health, is what I'm trying to say. They're not already indoctrinated. So his testosterone came up right around like 59 points, 60 points.
Oh, it came up. Okay.
Total testosterone came up. And I asked him, like, how are you feeling? And he was like, not that different. And granted, when he's traveling for these 2 weeks abroad, he can't bring his herbal tinctures because they're liquid. And he has some herbal capsules, but herbs, if your system's broken down somewhere and the Leydig cells in the testes can't make testosterone, then herbs are only going to be able to stimulate what you already can make. So I think a lot of people don't understand the kind of pathophysiology of like mitochondrial disease breakdown in the testes and the adrenal glands. And they don't understand that, hey, if this person's not getting proper sleep and nutrition, they're already at a deficit for years, plus their stress levels through the roof. I mean, for someone to be addicted to nicotine, they have to have this chronic stress going on internally and externally. So I think the level of ignorance to say, like, why doesn't someone suffer through something like that? I mean, I guess my counter would be, well, why don't you take all your patients off thyroid medication and ask them to work out their lifestyle? So, and in pathology in med school, we all learn that there's this point of cellular necrosis and tissue death, and you can't get that back. So I think the shocking point is, and this kind of leads into one of my points that I messaged you about, is that men in that low T clinic and in my practice now is I see men in their 30s and not so much in their 20s, because I don't really see patients that young here, but I have over the course of my brief career so far seen men in their 20s, and they're professional athletes and bodybuilders, and they had testosterone below 400.
Yep,
and
I see it.
Yeah. So I think people don't understand the severity of, this metabolic breakdown at the cellular level. I mean, we understand metabolic syndrome today probably more than ever, but I don't think we understand, I don't know what we would call it, early onset hypogonadism, young people with low testosterone, which doesn't make sense if you're coming from this theoretical textbook world and you just haven't seen large numbers of these male patients.
Well, and I think you hit on something really good there too about the age. The patient you just talked about, he said he was 40.
Yeah, he was, I think, right around 38, 39.
Yeah, and I see that all the time. And I think one thing you had mentioned in the comments is like, and this goes for ED as well. When my patients will go to a urologist or a primary care, and they say, "Hey, doc, I think my testosterone's low." Doc's like, "You're 38, you're fine." Or he's like, "Hey, I'm not having that great of erections." Urologist's like, "You're fine, you'll get over it." And it's like, these are real problems. Is this what you're seeing too, or?
Oh yeah, all the time. Or they'll have like just their total testosterone tested by a doctor, their primary care doctor, and then they'll come in and see me, and I'm like, "Where's your estradiol? Where's your sex hormone binding globulin? What's going on with your red blood cells and liver and kidney function?" Like pretty basic, conventional serum lab testing, and yeah, it's all the time.
Yeah, well, and I think that's one thing. In my second year medical school, I went to the AFRM and I listened to would have been Herzog and Rothenberg at the time, and I was really, I would say, confused because of looking at the levels, because he's like, basically everyone's low, and I'm like, nah, this is some type of like Ponzi scheme for these low T clinics to make money.
Right.
And when I got out and I see all these guys coming in, and like you said, you're like 25-year-old, his testosterone's 250. And he looks pretty well put together. He's like, my wife's, it's stressful, but it's not like he's working 60 hours night shift. He's like, yeah, I work 40 hours a week as an engineer. I'm kind of stressed. And like I just saw one 28 years old and his T was like 296, engineer. He's like, I work hard. I still go to the gym, and he's doing some of these things right. So, I had a huge moral dilemma. I'm like, man, do I treat this guy with, and I would do Clomid or ECG. Do you play with either of those at all?
Yeah, I've done not a ton, but probably maybe like 10 to 20 cases of Clomid with HCG, and we would do HCG 500 IU sub-Q injection 3 times a week, and then Clomid, and then like DHEA capsules. I have seen it work and I've seen it not work.
So do you usually go straight to, with most of the guys that come in with low T, if you're saying, hey, lifestyle isn't looking like we can make a lot of movement there, it seems mostly straight to the testosterone?
I mean, if they were 30 or, under age 34 and they were wanting to work with me, I think I would do HCG and Clomid first if their levels were above 400, and assess kind of their stress and stuff. And I think I would do it for 6 months and 3 to 6 months and just check in.
So devil's in the detail, right? And so you're doing that for fertility and stuff, right? Like if they're
young, I would do that for like probably a 6-month trial and check in with blood work every 12 weeks. And then after 2 follow-ups, see how they're doing. My patients are typically, except for a couple outliers, I would say everyone's 38 and older, roughly. 38 to 55 is kind of like my patient demographic right now. I do have some patients in their early 30s and around 30, I have someone now that I could do the HCG and Clomid with, and I think they might be a good candidate for that. The hard thing with something like that is, the Clomid's not too hard, but the HCG injections, I just find even twice a week, 500 IU is compliance, even with I do it with low testosterone just to keep the testicular testosterone levels up, because some guys freak out when their testes start to atrophy a little bit. Even if they're like, hey, I'm done having kids, I don't even care. Usually I keep that on board unless they say I really don't care. because I don't like to get text messages about that.
Yeah. Well,
So,
tell me, you can give me maybe a little bit of the quick and dirty. You did was it a webinar this weekend for the update in bioidentical hormones?
yeah. So Dr. Paul Anderson, one of my teachers and mentors when I was at Bastyr University, and he asked me to do 90 minutes on his bioidentical hormone replacement therapy update.
Do you want to talk a little bit about what bioidentical even means and how that works and what's considered bioidentical?
Sure, yeah. So I think it kind of going back to the Women's Health Initiative study in the 90s, which was a complete catastrophe, and all these women got cardiac events and cancer, and they're using horse urine extracts, like synthetic hormones. So from that, well, we learned that synthetic hormones are carcinogenic and cardiovascular risk in women and men, and we're still using them in medicine in low doses and like birth control pills every day for women, which is a huge problem for men as well, because we're all kind of like bathing in this birth control soup.
Yeah.
And no one's really talking about that for the male side. Talk about that for women now more, but I think someone needs to write a book. I think someone wrote a book, Estrogenation or something like that. But
Yeah, Jay, what the heck's his name? I just ordered the book. Jay, he's been on Jay Campbell's show in a little bit. Jay,
yeah,
doctor,
I'm definitely going to order that book too.
Mm-hmm.
But I definitely think more people need to be talking about that. But anyway, so we learned from that study that synthetic hormones are not safe, essentially. And bioidentical hormones mean that they're identical to your own hormones internally. And they're usually extracted from wild yam, and that's different than the yams that you would buy at your grocery store. Wild yam is like an herb tuber that grows in like Central America and like these tropical environments, and they make progesterone and testosterone. And it comes into the compounding pharmacies in like a big jug or container, and it's a powder. And then they can mix it and compound it in their clean room underneath a hood into a cream, gel for topical use, pellets for testosterone pellet therapy, and injections. So usually injections are mixed with like sesame seed oil or grapeseed oil is what I prefer.
Do you have a preferred method of delivery?
Yeah, what I find best is either IM or sub-Q injections twice a week of testosterone, enanthate, or cypionate. I also like the cypionate propionate blend.
Mm-hmm.
So that can be good for guys that aren't noticing the benefits soon enough, and they just need that shorter half-life from the propionate upon injection. Or they get kind of sensitive to the cypionate ester over time, and they're just or unsensitive to it. But those are my go-to kind of two prescriptions for men. If someone's, super busy, they could do once a week injection, but you would want to make sure that like their sex hormone binding globulin is not too low, because then they'll just be kind of like urinating out their testosterone faster. But yeah, the twice a week injection, something that some doctors have experimented with is doing sub-Q or daily IM injections of the propionate, but that takes some like engineer level diligence where you're just super anal retentive about injecting every morning. Cream applied twice daily to the scrotum or hairless areas of your skin. But creams, I really haven't found, have you seen creams work really well for you? I haven't seen them work too well.
No. I think that, I don't know if it has to do with half-life or if it's proper. I almost think maybe that if they're applying it in the same place every day, it saturates its uptake. But creams and gels, just when I look at the levels, are almost always low. They're almost lower most of the time.
Yeah.
So I got biased real quick with the injections, but sometimes if a guy's like traveling, I'm trying to think, maybe a guy went to Israel or he went somewhere where with something with the needles or the testosterone was a problem. I let him use the cream for a couple weeks doing that, but I'm with you. I started off with the 200 milligrams once a week IM, And I actually think that works from what I've seen to about 90% of guys with little amounts of side effects. But anytime there is side effects, the twice a week seems to knock that out. I've not had to go to more frequently. But I've thought about it, but I haven't. And I've just recently started doing more the subcutaneous. I have seen a guy or two get itching and a little bit of like bruising in the stomach. Is that normal? Do you see that? Or
yeah, definitely. I just think like the subcutaneous tissue can be like, even with HCG injections, like it's just more sensitive. And you know, if people hit like a hair follicle or something, that can really hurt, and bruisings can be normal. The different esters, some people react to those, or I've noticed I've had someone react to the cypionate a few times over the years. Probably 3 times.
Okay.
Pretty rare. And I think that might be the benzoate.
Yeah, that makes sense.
They had like they did a thigh injection, IM thigh injection, and they said they had swelling around their kneecap and their whole thigh was like allergic reaction. And the compounding pharmacist actually didn't even really know what it was and said that that's super rare. So I guess for the listeners, I would just kind of like, don't be freaked out. The side effects overall are so minimal at the low dose.
But prostate cancer, right?
Oh yeah, everyone's gonna get prostate cancer.
Yeah, everyone on TRT is gonna get prostate cancer. You want to fill people in on that a little bit?
Yeah. So the long and short of it is that we know now that you're more likely to get prostate cancer if you don't optimize your testosterone to DHT and estradiol ratios and balance out your estrogen ratios than if you don't. So if you have, there's an article, a great article that everyone can read on life extension. Dr. Abraham Morgan Taylor, an MD urologist who teaches at Harvard, he started because he talked to one of his professors from Harvard and said, "Oh, I'm going to start doing testosterone therapy." And he said, "Oh, I wouldn't do that if I were you." These are a bunch of urologists. So in the urology world, it's very feared and has been since Huggins won like the Nobel Prize for, I think it was like medical physiology in the 60s. In 1941, he did a study, and I think it was on like dog castration. And they found that testosterone caused prostate cancer in that study. However, now we know that it has to do with like receptors on the prostate for estrogens and all this more complicated stuff. But what you need to know is that men in their 30s and 40s who with low testosterone and higher estrogen and DHT and things like that are already starting to get kind of like prostate cancer developing. And what Dr. Abram did is he did biopsies and he discovered this even before giving testosterone to these men. So we have, there's multiple other doctors doing research on it besides him. So we have the evidence. It's just that this old study from 1941 is still in everybody's brains, and it's hard to get that out, especially when the media takes something and just like blows it out of proportion.
Well, if you want to look at censorship, if you go onto YouTube and you like Google testosterone, it's like all Mayo Clinic, like, there's like mainstream views of it, the first 5 videos. So I don't know what's going on there, but it's tough. That's why we have to have conversations like this, man.
Yeah. Google and all the major corporations decided to get a little bit more strict in the last 6 weeks here for their censorship. Mm-hmm. It's too bad for the public, really, because I think what's going to happen is we might have to go back to the days of like zines and just have everything on paper and like email it to people.
Yeah, for real.
So it's like, hey man, I'll send you some snail mail about this.
Well, you have to. And I had a channel, and I don't even know why. I get kind of controversial. My original channel on YouTube was deleted, and this was like 2 years ago. Like I got a strike, and they told me, hey, can't do that. And I think the first one was like a B12 injection, and I showed it, and I didn't know. I just asked what I did wrong. They didn't tell me. And then like a week later, they just banned my whole channel, which I can't think they can do now. I think they have to give you 3 strikes, but
That's horrible.
yeah, I mean, I'm all about, I'm a small town farm boy from Illinois, turned naturopath doctor. So I'm all about exploring and learning new ideas. And like flat earthing's banned. And I'm like, okay, so I'll listen to you. Like, okay, talk to me about it. I think it's an idea. And to me, I'm more scared about when they hush things than when, they're allowing people to speak. Cause it's like, are you afraid of them to say something? And the vaccine movement's kind of like that now. I'm kind of in between on a lot of that, but I'll listen to people, both ends. I want to know side effects. I want to know benefits. I want to know everything. Same thing with testosterone. So
Exactly.
a lot of times it just gets shut. Oh, prostate cancer. No. And I'm like, what I tell most of my patients is, okay, say you're 65 years old and you have a family history of prostate cancer and you're feeling like shit. I have some guys are, they're suicidal when they're that low. Like, can you live another year with the way that you're thinking right now? Or, is that to me worth risking the prostate cancer, even if it was true? That's the way, at least I try and put it, but
right. Yeah. And they're doing more kind of avant-garde studies in Europe with testosterone therapy with men who already have late stage prostate cancer and improving their quality of life.
Yeah.
So the way I look at it is that prostate cancer is a chronic condition. And when someone has it, it's a different ballgame. Like, I'm not going to put a prostate cancer patient on testosterone therapy. I don't have enough money or enough lawyers around for that. So, but I would say to anybody listening to this that if you're looking at or already doing testosterone optimization therapy, for the most part, if you change your diet, lifestyle, get on a paleo ketogenic diet, do fasting, intermittent fasting, water fast, you're working with a naturopathic doctor like us or a functional medicine doctor who knows what they're doing, you can potentially prevent something like this. It's more likely, if you're going to roll the dice in your favor. Mm-hmm. And if you still get prostate cancer, then you're probably going to have less severe prostate cancer than you would anyway. And up until recently, most men who got prostate cancer died from a heart attack or stroke, or neurodegenerative disease or something. Mm-hmm. Not prostate cancer. More recently, when I say recently, in the last 5 years roughly, it just seems like prostate cancers have been getting more commonly, that they're more aggressive. And I think this has triggered more fear in men. And I have a fair amount of cancer on one side of my family. And I had some anxiety around cancer. However, if someone has a first degree relative, a mom or a father, that they watch die of cancer, I know that, and I've seen that in my patients' eyes, where they have this kind of like unchangeable panic and fear around getting the same cancer. And I'm sympathetic and empathetic to that. However, the data's there. I'm gonna put my own money on it that I will optimize anybody who's ready as a patient, their hormones, male, female, so that they can be as healthy as possible to prevent all diseases, diabetes, cancer, et cetera. And we know that cancer is metabolic. So, there's this whole thing around like ketogenic diets today for cancer patients and fasting and stuff like that. So, if you can, not just your hormones, but work on your overall metabolism and weight, body weight is from the guy who wrote The Emperor of All Maladies, Dr. Siddhartha, I forget his last name, long Indian last name. And he says in his podcast with Dr. Peter Attia that obesity is, after smoking or with smoking, is one of the biggest precursors or determinants of getting cancer. So if you have, a high body percent fat, and you have a lot of visceral fat, and that's just kind of like your constitution has been hanging around your body for a while, get rid of that and detox and get in the sauna. So I think there's just so much that people can do for their health, and before even going to a doctor, that And, obviously it's better to do it with the care of a doctor, because if you start getting like headaches or constipated, you have somebody on board that can help you through all those kind of setbacks or potential setbacks that would derail somebody, and, coach you through it. But there's so much that people can be doing out there now, to optimize their hormones and testosterone specifically. I've been listening to Why We Sleep, the book that's out now. And he talks a lot about how the testes actually shrink in size when we get less than 7 hours of sleep at night.
Mm-hmm. Wow.
So, and muscle mass. So if you're not working out, you probably won't notice a decrease in muscle mass. But I mean, I'm like a pretty tall, lean guy. So if I stop working out and I start working late at night, and I own my own business, so I can do this easily, where I can be up to midnight working 3 nights in a row and not getting to the gym enough, or, running on the trail or something. And I can notice on my body, I can see visually, things have changed from not getting enough sleep. Whereas maybe somebody's bigger, or they don't exercise that much, or they didn't grow up playing sports. Like I was pretty much forced to play sports growing up, which I'm glad I was. But for those of you that aren't exercising, you might not notice that. But for those of you that are, if you want to get muscle gains, they say sleep big, eat big, and lift big. So
love it.
Yeah, that's right.
Well, yeah, I just 3 S's. When guys are like, what can I do naturally? Sleep, sugar, and stress. Just try and get a hold of those things. You're 90% there. So a lot of what we're talking about, is this what you guys hit on the webinar? Are we leaving anything out?
On the webinar, we were talking really specific into like dosing and contraindications, and I focus mostly on testosterone for men, but there's a little bit about, there are some treatments you can do with like pregnenolone.
Yeah. Do you supplement with DHEA, pregnenolone, progesterone, or those things that guys should be looking into if they're on testosterone?
Yeah, I would say if you're not, and if you are both, pregnenolone can become other things. So I call it like the mother hormone. Some other people call it that too. After cholesterol, we get pregnenolone, and then pregnenolone can become in your adrenal glands, your adrenal hormones, and then in your testes, your testosterone. So pregnenolone is mostly indicated, I look at people's symptoms. So are they starting to get like some cognitive deficits? Maybe they don't have dementia yet, but they're, wondering, like they'll drive from their house to the grocery store and they forget half the stuff they were going to buy. Or someone says, hey, it's not on your list, but like make sure to get milk tonight. And then they come home and they didn't get milk. And that happens all the time. Or they can't remember their car keys are, things like that. If that's chronic, then that with anxiety, that's pregnenolone deficiency typically. And I mean, you could spend money in the blood test, but you usually want to see pregnenolone around 100 in the blood in the morning or above. And then DHEA, some doctors do DHEA 50 to 100 milligrams in the morning, capsules. So you can get like the 50 milligram capsules and just have someone take 2 every morning. Ashwagandha increases DHEA, and meditating. Dr. Jonathan Wright talked about this at A4M conference I went to. I think it was back in like 2015 in San Francisco. And he talked about meditating just 10 minutes a day can increase DHEA levels.
All right.
So
love it.
Yeah, lifestyle. If you're not a meditator, then, maybe get some guided meditation app like Calm or Headspace. If that annoys you, then maybe get a therapist.
Yeah.
Kidding.
I use YouTube. I go on there and I find some like affirmations that I like to listen to. Even like poems, like if you're into Emerson or I'm trying to think, Bukowski. like there's some cool poems, and I'll wake up in the morning to motivate myself and stay kind of calm.
I really like that. Yeah, that's good.
Yeah. Yeah. And it's just like anything like music. We live in a world now where the technology's there, people that you can just, all you gotta do is reach out to your phone and you're 90% there. So
yeah,
a little bit of a sidestep. We talked a little bit, I think it was actually in Jay Campbell's group, about stool testing. Can you just talk about a little bit of what else you do as a naturopathic doctor, aside from the testosterone? Some areas.
Yeah. So let's say I had a patient and they said money was no barrier and time was no barrier, because that's usually people's barriers to moving forward with doing everything under the sun. And they said, let's just kind of like open up Pandora's box. And
I want to come to you. I want to be as optimal as possible aside from testosterone. What do we do? What can a naturopathic doctor offer?
Yeah, so I like to do stool testing, and I've been using GI Map from Diagnostic Solutions. It's qPCR testing. I've been using that for, I think, over 2 years now. And that technology was not around when I was in naturopathic medical school, and we didn't really talk about anything besides like an O&P times 3 stool test and like a CDSA. So that's what I do, and it gives you a lot. It gives you healthy bacteria, pathogenic bacteria, viruses, and protozoal parasites, worm parasites, and like secretory IgA, which is like your immune system in your gut. FDA approved marker for Crohn's disease and ulcerative colitis, IBD. So that's calprotectin, and some other inflammation markers. Also tell you if someone's eating gluten or gliadin, actually. So it's a good kind of like lie detector. If someone's like, yeah, I'm gluten-free. It's like, well, it's in your poop. So either you gave me someone else's poop, or you didn't know, maybe they didn't know that had gluten in it.
Yeah.
Because sometimes people make like a hamburger with gluten. The other test I would do would be organic acids, which is very comprehensive. There's like 76, 78 markers, depending on which lab you go with. And I like to use Genova Diagnostics Organics or Great Plains Lab. So I kind of alternate between which one works best with the patient's insurance, or which has kind of like the best direct cash pay value for them. So I would do those two.
What do organic acids tell us?
Oh, organic acid. So it's a urine test. You test your urine in the morning. You basically dehydrate yourself to get a concentrated urine sample. No water after 7 p.m., no liquids. And then you do a first morning urine sample, and you just send in like 10 milliliters of urine frozen. And then the lab tests it. And the organic acids are all your mitochondria kind of like urine metabolites. And then we can look at detox metabolites. We can look at if there's yeast or bacteria in your gut or parasites, because those will kick up certain metabolites. We can see if you do the Great Plains Lab, we can see if someone has a lot of body aches and pains. It's good to do that one, because it'll tell you what's going on with certain markers to look at that. Oxalic acid marker is a good one, because those crystals can get caught up in joints. So if you have someone that's like, hey, I have a lot of joint pain, you can look at their oxalic acid levels. Also, fungal infections in the gut can cause that. So most people today have some gut dysbiosis that's kind of generalized. And without the right testing, I feel like most doctors are just shooting in the dark. And I'm on this small intestinal bacterial overgrowth discussion group on Facebook. And I see a lot of people suffering with what we call, the SIBO, which is really SIMO, which is small intestinal microbial overgrowth. And usually it's fungus and bacteria. And it can be upper level stomach infections with H. pylori, which you can test in the stool sample too. And so my point being, if we don't have like a true diagnostic, similar to if we don't have a true free and total testosterone level and estradiol level, then, what the hell are we treating here? Like, what are we working with? So I don't like to just like give people berberine and other antimicrobial herbs unless I know what's really going on there. And then you want to break open the biofilms in their gut, which people can have pretty bad reactions to if they don't have binders on board and they're not like drinking enough water and sweating. And so it can be a process, and things like that are really stubborn. So some people can take 2 years to resolve, but usually after 6 months, they're about 60 to 90% better.
Mm-hmm. What's your opinion? Do you use any other, with testosterone, some of the other, I guess, longevity, therapies, I guess, or supplements, and NADs becoming popular, metformin, tadalafil, you had mentioned a little bit about berberine. You play with any of those things? Are they safe, they healthy, they help, or any of them you like?
Yeah, I've been using, I'm kind of like a slow to jump on the metformin train. I do have some patients on it. And I'm really excited actually on this note is because the quality control in berberine is a concern for some people, is that, and it should be, because quality control in all herbs should be a concern in all medications. The Berberine Active is a supplement coming out of Medeira. It'll be released at the end of August. And you can get their Berberine is going to be probably the best in the US market, because Medeira has to meet the pharmaceutical quality control standards in Australia, because herbs are regulated by their version of the pharmaceutical regulatory body.
I'll write that down.
So that really answers that quality control issue with berberine. So I'm going to start using that more. I do use metformin. Usually I start people at 500 milligrams twice a day and just make sure they don't have any diarrhea with it, because that can be a side effect. It does hit the microbiome pretty hard, but usually I'll, work on their gut health at the same time or beforehand. I think a lot of this stuff is, it would be awesome in an alternate universe just to have trillions of dollars to be able to do huge, 20-year clinical trials with 5,000 men on testosterone therapy for 20 years and 10,000 men on testosterone therapy with ipamorelin and peptides.
Mm-hmm.
And I love that stuff. I think the barrier for my patients is cost.
Yeah.
And eventually, after you've done the blood testing and you've prescribed 6 months or 3 months of ipamorelin, and they're already on testosterone, they're already doing some supplements, and they've already done the labs that I talked about in the blood labs, we're talking about pretty good investment into their health for a 12-month period. So that's the barrier. But in the low T clinic, we had 2 tiers of service. So we would do the testosterone annual plan, and then we had a longevity annual plan, and that would be peptides with testosterone therapy. And it would include all their visits and all their medicine.
And which peptides?
So at that point, we were using sermorelin and 2 different sermorelin type peptides together, or just one with testosterone. And we would test again in every 3 to 6 months.
For IGF-1? So you're CKC, ipamorelin?
Been using ipamorelin more now. I have 1 patient on it and hoping to get another patient on it. I'm excited to see how they do with it. Mm-hmm. These guys they're burning the candle hard. So they need it, So I'm excited about ipamorelin. The hunger with the peptides is the biggest barrier for guys. And testosterone increases hunger too, but not like peptides. Is that what you're finding?
Oh yeah, I did. I had Ryan Smith from TaylorMade on the podcast, and then I've done a couple of videos talking about MK, BPC, MK. You get hungry on that. Which can be good. I had a guy that was basically withering away, cachexic, and so he was on TRT, put on the MK, help him increase his appetite a little bit. The CJ and the ipamorelin, I'm using them together. I can't say that people have really said too much about hunger on that. The MK for sure. But again, it's a couple of handful of guys. Now I don't have 100 people to say, this or that. So, but there are things I was just asking guys come in asking for that now. Hey, I heard about this metformin, tadalafil. Should I be taking those? And
I like tadalafil. I really like tadalafil, and if you look at all those medications in that group were originally researched for cardiovascular health.
Exactly. Yeah.
Dilating the coronary arteries. I mean, we all have. I hate to think about it, but I probably have plaque in my coronary arteries building up, and so to dilate the coronary arteries, not just for sexual health, but I think tadalafil, and I mean, you could even, if you wanted to kind of mix it up, you could do like niacin too.
Nitric oxide, arginine, citrulline.
Yeah. And I like all that stuff. I think sometimes on the organic acids, it'll pinpoint what people need to do. So you could do like an organic acids and say like, hey, you really need like the B vitamins and the niacin, or maybe a B complex and L-arginine, like 3 grams a day of 1 gram of L-arginine, like 3 to 4 times a day, and see what's going on there and match it up with their symptoms if they're having like ED or something like that, or some fatigue or brain fog. I think a lot of people don't realize we're not getting enough blood to our brain, and then the mitochondrial stuff with metformin. I mean, that research is amazing. It's pretty cool. And we've been using that forever with diabetes. I mean, I haven't seen metformin always work well for diabetes. So I think that's where my skepticism really came when I believe I first was listening to Peter Attia's podcast, and then I kind of hooked up with Jay Campbell and talked to him and listened to his podcast about it. And I've read more of the research, and
I've seen some, and I mean, Jay have gone back and forth on that. I have seen some research, and their side is that the mechanism of action is blocking, it blocks basically the uptake of sugar. But to me, if you have SIBO and you're blocking the uptake of sugar, that sugar is going to sit in your intestines longer. I've just seen some articles showing that it increases dysbiosis. So probably it can go both ways, and it's probably an individual question to see if a person should be on the metformin or not. And so that's why I haven't really been using it so much for more longevity purposes personally. So, but there's a lot of good research out there too. So it's hard to argue either way.
I'll let you know how it goes with my current patients. I haven't had any of them complain about side effects yet. And
like GI stuff.
Yeah. And these guys have all pretty much had like their gut healed and fixed for the most
part. And that's what I think would be a good idea, to see a naturopathic doctor first. So to me, if you're someone who's metabolic syndrome, you throw on a metformin, you block sugar uptake, they already have GERD, they already having some SIBO. To me, it's like, I don't know if that'd be a good idea.
Yeah, so I'm with you on that for sure. I think I have maybe, let's say like 4 patients on metformin. I think the other thing that comes into this conversation is like the affordability long-term. If somebody's insurance is going to cover metformin and they have, pre-diabetes or diabetes, and you could like pin it to their insurance, and they're not having side effects, and they have the SIBO cleared out and the microbial gut infections cleared out, I think that's a good option to go with. If they're not going to have side effects. I mean, as an herbalist first, of course, I lean towards like the best berberine. So that would be the Madeira berberine. But, it really depends on the individual, because like we're doing N of 1 medicine, right? So. Yeah.
But there's also things to be, how research is too. It's hard to tell what goes on in there sometimes. And I can only see firsthand what happens with my patients. You're like, well, this works and this works. And I do with my patient. I'm like, 10 guys in a row, it didn't work. I'm like, all right, whatever. So
yeah.
But I tell you what, Dr. Sam, I think we sucked out quite a bit of information from you. Can you let the good listeners know where people can find you and work with you?
Sure. Yeah. You can go to apollohealthclinic.com and check me out there. I also have a free 10-day video and email program people can sign up for on that website. If you go to programs, it's the 10 days and 10 ways to optimal hormone health. And we cover thyroid, adrenals, testosterone, estrogen, etc. So
cool. And then you're in Seattle, and you're also in we're at Montana.
Yeah, I'm in Whitefish, Montana, right next to Glacier National Park. So northwest Montana.
Awesome. Well, thanks again, Dr. Sam. All this will be in the links below, and so people can go ahead and find you. But until next time, man, we'll have to talk again.
Yeah, look forward to it. Thanks for having me on. Take care.
You got it.